Good afternoon. I'm gonna do a quick video where I briefly talk about how to write the professional psychological report. So today we're gonna focus on a skill that every professional counselor must develop, the ability to write a clear, ethical, and culturally responsive psychological report. Your report is not just a summary of test scores. It's a document that translates assessment data into meaningful clinical understanding and ultimately guides treatment referrals and client care. So hopefully by the end of this video, you should be able to understand the purpose of a psychological report, identify the major sections of a standard report, and write your using professional and objective language. And finally, connect assessment results to diagnosing and treatment planning. Okay, so let's begin. First, we want to start off with section one. Why do we write a psychological report? Psychological report is a formal summary of assessment results, and it answers the question, what is going on with your client and what do they need? So reports are used by counselors and psychologists, psychiatrists and physicians, schools and disability service offices, courts and legal systems, and sometimes by clients themselves. A good report should be clear, accurate, objective, culturally sensitive, and of course, useful. Think of it this way. If another professional picked up your report, could they understand the client and continue treatment without confusion? If the answer is yes, that means you've written an effective report. Section two, what I want to talk about is core principles in good report writing. There are a few major principles to keep in mind here. I want you to remember these throughout the semester. Number one is clarity. Avoid jargon. Explain what scores mean in plain language. Number two, objectivity. We report behavior, not personal judgments. For example, the client arrived 20 minutes late instead of the client is irresponsible. Number three, cultural contextual awareness. Testing is not culture free. We must consider language, socioeconomic factors, trauma, disability, culturalization, and experience of discrimination. And finally, number four, confidentiality and ethics. Everything in a report must follow HIPAA, ACA ethics, and laws regarding record keeping. Next section I want to talk about is the actual structure of a psychological report. Let's walk through the typical structure step by step, and you'll use this format, hopefully in your practice and definitely throughout this course. First is identifying information. This is the who, when, and why part of the report. The client name, age, the pronouns, date of evaluation, evaluator's name, referral source. This section also tells us why the client is here. Reason for referral. The answer to the question, who asked for the assessment, and what are we trying to find out? For example, client referred by a primary care physician due to increased depressive symptoms, evaluation requested by the university disability office for tested accommodation. This section keeps the report focused. We only answer questions relevant to the referral, okay? Then we look into background information. Here you summarize relative information and relative history, medical and psychiatric history, substance use, developmental and educational history, family or relationship stressors, cultural identity factors, trauma history of relevance. The key word here is relevant. What do we include? Why do we include unnecessary personal data? We don't. Okay. Do not include any unnecessary personal details. Then you go into behavioral observations or the mental status exam. In this section, you describe how the client presented during the evaluation. their appearance, their eye contact, mood and effect, thought process, cooperation and effort, concentration, speech, insight, and judgment. Be behavioral and objective, not judgmental. We do not write client looked crazy. Client was dramatic. What we do write is client appeared anxious, frequently fidgeting, and avoiding eye contact. Then we look at the test that we administer. Here you list the tests used using full titles: Beck Depression Inventory, Beck Anxiety Inventory, Beck Hopelessness Scale, the Generalized Anxiety Disorder 7, a clinical interview. Those are the things that we'll look at. Think of this like your methodology in a research paper. What tools do you use to gather data? Then you look at the test results and interpretation. This is very important because this is the actual heart of the report. It is not enough to list numbers. You must interpret the results, right? Instead of BDI-2 score equal 29, you will say something like the client scored a 29 on the BDI-2, which falls in the moderate to severe range. They endorse fatigue, hopelessness, difficult concentrating, which is consistent with symptoms of depression. Clients and referral sources need clear and understandable language. Also remember, explain patterns, strengths, and limitations. For example, low test scores might be affected by language, trauma, attention, cultural factors, or test anxiety. Then you look at the diagnostic impression. Here's where you apply the DSM-5-TR. You should name the diagnosis, list the specifiers, and provide supporting evidence. For example, major depressive disorder, moderate, recurrent, without psychotic features. Client meets criteria based on depressed moods, sleep disturbance, fatigue, difficulty concentrating, and feelings of worthlessness for over 2 weeks. Include the V codes or Z code to describe psychosocial stressors. All right. Then you summarize the and use any clinical impressions you might have. This section ties everything together into a narrative. You should briefly answer these questions. What is happening? What is causing distress? What are the strengths and protective factors? Make sure you keep concise, but make it meaningful. And then you'll finish it off with recommendations. This is where your clinical judgment matters. Recommendations must be realistic, clear, culturally responsive, and directly connected to the assessment results. An example would be like weekly counseling sessions focused on depressive symptoms, psychiatric referral for medication evaluation, academic accommodations such as extended time and reduced distraction testing environment. If you cannot offer a recommendation, don't include one. Only suggest intervention supported by the data. Okay. Remember, your report is a legal document. Language should always be professional, neutral, respectful, and person-centered. We don't label persons by a diagnosis. We don't write schizophrenic, and we write a client with schizophrenia. We don't write the addict. We write the client living with substance use disorder. Remember, language matters. Common mistakes a lot of students make are listing test scores with no interpretation, opinion disguised as facts, cultural bias or assumptions, diagnoses that don't match the data, recommendations that are too generic. Remember, always avoid your report telling the story of the client through data. It always should tell the story of the client through the data. In this assignment, what you need to do is practice your skill set. Make sure you understand reason for referral, behavior observation, test interpretation, diagnosing, and recommendation. Okay. So, in closing, psychological report writing is one of the most important professional skills you will develop as a counselor. It reflects your ethical responsibility, your cultural humility, and your ability to transform assessment data into meaningful treatment. So, if you have any questions, don't hesitate to reach out to me, bring them to class, or email me. I look forward to working with everyone, and take care.